Hi guys, Reid here. As I travel around the country, one of the most common questions I get is how do I tell people about fresh bennies? Well, we are a fresh approach to benefits, but what I suggest you do is frame the question well and then you demo it. And I want to show you that today for just a quick couple minutes on the fastest way to get somebody to engage with us. And in framing it, talk about their biggest issue they're dealing with, and that is as medical costs have gone up, so have out-of-pocket costs. And what it means is now every single time people touch the system, they're feeling out of control. And so what we did at Fresh Bennies was we went out and looked for tools that would help people control their health care. And then we rolled them into a bundle because although these services are available elsewhere, people aren't engaging with them there. And so then I go to the app, and I love to be able to show this in person if I can because it really engages better. Specifically, I'll say, hey, there's 4 different services in here that are in our core bundle. The first is primary care visits over the phone with telehealth. Click through here, let them see that the descriptions are there, and if a person wants to try it, give a shake, and 2 clicks and a shake and you're off to calling a physician. And while that makes sense for primary care issues that are more urgencies, Doctors Online is to help with those kinds of services that otherwise people are going to WebMD and Google for. And instead of that, you can have, look at this, this is my inbox with various questions I've asked of various physicians. All different specialties are available there. So no cost for a person to use telehealth or Doctors Online. Then of course advocacy, and we've got our new advocacy provider, Compass, who we're working with. And the reason we love them is that they're very much able to help with, and then you list off a few things that they can do. Help a person find a best quality doctor. Help them find the best location and quality to get a service done. Help with medical bills or even negotiate an out-of-network claim. So that's advocacy. And then as we come back to the app, we'll reference that the 4th item, we'll skip past the orange icons, which are add-ons. The 4th item really shows up here, and while it shows up as 9 icons, just reference it as the 4th item. And that is that there are consumerism savings networks available for things that are starting to be pulled out of plans, whether it's prescription savings for some of those drugs that are making it on a non-formulary list, or dental or vision or chiropractic. Then one of the questions we get, people say, well, I didn't really know when I should use telehealth versus Doctors Online. And so we've created what we call this helper tool. And it says, I can help you find the right service. Click on through here and a member will see, yeah, I have a medical question for a specialist. Okay, well, that's one thing. Or I need a new member packet. Or I need a second opinion on a diagnosis. And so what we've done here is help guide people with this and with our artificial intelligence assistant to help people find the right thing. Sometimes you might have people ask about a network on the savings networks, how it looks locally, or they might ask how a drug price looks. And on this, it's my pantoprazole, it's my acid reflux drug, ranges from $11 on up to $40 at different locations around. And of course, under my profile, not only can a person save their other insurance cards, but they can click on through here and have the virtual version of their own Fresh Bennies card. So the nice thing for us is that this just pulls people into seeing the value of all of these services delivered together. It helps them understand how and why we're getting far more usage than anybody else in the industry at 71% average usage amongst our groups. Go out, tell the story this way to 10 groups, let us know your results. Take care.